The coronavirus, people would have been more aware of it's in the national news all the time. Of course, out in Wuhan in China, we seem an awfully long way away, but we do have to be sensible about it and take our own precautions.
We do, yes. This is Wuhan novel coronavirus. Coronaviruses are a family of viruses, of which there are about 6 that we know of, and now we have this new one, which will make 7. They're important because they can become transmissible. They emerge very often from Asia, and the reason for that being that they tend to emerge where they cross the species barrier from an animal into humans, and that tends to happen in places where populations are very dense and where people are living in close proximity to animals, and where perhaps hygiene conditions aren't what they could be. So the theory here is that this new virus is connected with the livestock and wet food market in Wuhan.
How concerned should we be on the Isle of Man then? Because it's very easy to think, oh gosh, we're a long way away. But of course, international travel being what it is, someone could be in Wuhan, yesterday and be on the Isle of Man tomorrow tea time.
That is very true, although they would find that difficult now because, of course, the Chinese authorities have reacted very quickly and have stopped international flights and indeed are doing their best to stop people leaving Wuhan. So the risk is going down in that respect, but you're quite right, international travel does mean that these things can spread very, very quickly. And indeed, they always could. That was certainly a feature of the 1918-19 Spanish flu pandemic. That spread incredibly quickly even back then without the international travel that we have now. So this is a risk and it does need to be managed. We shouldn't be complacent. We know now that it is possible to have person-to-person spread. Obviously, when you're dealing with a new virus, at the start, there are an awful lot of known unknowns. One just doesn't know details like what exactly is the incubation period, at what point is somebody likely to be infectious, etc. So initially, the public health actions have to be very precautionary to take account of all those things that we don't actually know.
And am I right in thinking that this type of coronavirus can or is known now to be infectious whilst it is in the incubation period?
That still isn't definitely known. Most coronaviruses, certainly the SARS and the MERS, were only infectious once people were symptomatic. There is a suggestion that that is not the case with the Wuhan novel coronavirus, and that people may be infectious before they have symptoms. That would be similar to influenza, where you see a similar pattern.
So what practical steps can we put in place on the Isle of Man? Because we have to be aware, we don't want to panic people, obviously, on the one hand, but on the other hand, nor can we afford to be complacent.
No, I mean, at the moment, there is very little in terms of public advice to give. People don't need to change their behaviours. The only exception to that is anybody who has travelled from Wuhan in the last 14 days. We're not aware at this stage that there is anybody who falls into that category. But if there should be, and if anybody hearing this can identify themselves or somebody they're close to as somebody who has travelled to the island having left Wuhan within the last 14 days, those people should stay at home, avoid contact with other people. They should notify their GP that they have returned from Wuhan, and the GP will be able to contact the appropriate authorities to find out exactly what follow-up may or may not be required.
And staff at the airport and the sea terminal, they're getting or being prepared to help travellers seeking advice if they're returning. Is this the sort of advice that they're able to offer?
We are getting that in place. Although, to be honest, people that come to the Isle of Man will already have left a port of exit where there will have been high risk. So if they've left a port of exit in China or a number of other places in Asia, USA, Australia, Singapore and so on, where they've already had more exposure to this, they will have been given advice about what to look out for and what to do. If they have come from an area of concern when they land at an international airport elsewhere in the British Isles, They will have been given appropriate advice about when to report before they leave that airport, or if they develop symptoms after they've left the airport, what they should do. So by the time anyone gets to us in the Isle of Man, given that we obviously don't have international airports or other ports in that sense, people should have had advice on more than one occasion if it is relevant to them, and they should already know what to do. So anything that is in place here should be very much belt and braces. But we are going to make sure that port staff know what sort of advice to give and what to do should a person be symptomatic and be potentially somebody who might be a potential case of this virus.
So do we have to stay, when I say we, the department on the island, we have to stay basically in daily communication with the likes of Public Health England and the World Health Organisation in order to keep up to date on exactly what's happening?
Yes, indeed. Public Health England is actually the nodal point for coordination and leadership of the public health systems across the whole of the UK and the Crown dependencies. So we're obviously a Crown dependency, so we look very much to public health. We're in part of that system, the Public Health England system. Public Health England, of course, takes advice from the World Health Organisation. So there is very much an interlinked international response to this, which we are part of. Public Health England publishes updates at 2 p.m. regularly, and if anything was to change massively, say, for example, a case of coronavirus was actually diagnosed in the UK, then there would be an update as that happened rather than waiting for the 2 p.m. regular update slot.
I know you mentioned several of the previous sort of viral attacks we have. Is this sort of something, it's nothing new? Viruses are always evolving and changing. Is this something that we just have to expect, I suppose, as a species going forward?
Yes.
They're always going to be there.
They are always going to be there. There are things that we can do, certainly trying to reduce the conditions that encourage it. It's what happens here is jumping from one species to another. So with SARS, it started off in bats, passed to civet cats. Civet cats were considered a delicacy in certain parts of Asia and were therefore in live animal wet produce markets. Poor hygiene, that's how it gets into humans. And, once it mutates, then it can go not only from the civet cat to the human, but it can go from human to human. MERS-CoV, which is the Middle Eastern one, which is still around but has been very much more contained, that went from bats to camels to humans. Again, for similar exposure reasons. With the Wuhan novel virus, we haven't yet got proof that it's come from bats via a particular species in that wet food market, but the probability is that that was the vector. So clearly China is taking very strong steps to control exotic species and hygiene conditions in those markets, and that really is the point where the control needs to be all the time, because repeatedly that's where we see these problems originating.